Good health includes nutritional fitness as well as physical, behavioral, and mental fitness. The single best indicator of nutritional fitness is maximal waist circumference. No more than 35 inches in men and 30 inches in women. Measure it, improve it, and maintain it, and enjoy the good health it brings. I'm Dr. James Hurd, a physician specializing in preventive behavioral medicine and cardiovascular rehabilitation. Components of total health fitness are all part of health, morale, and best possible performance. They include nutritional fitness, physical fitness, appropriate behavioral response, ideal medical management, best possible adaptation to environment, psychological understanding and response, immersion in social setting, and rational spiritual guidance. Skills and specific actions are required for health fitness. Good health doesn't just happen. Options for improvement and options for harm are always around. Choices must be made. It's not even enough to know what helps and what hurts. The best choices for good health are not always the easiest or the most attractive. It takes training to know what to do and consistent action to achieve and maintain good health. Nutritional fitness heads the list. It includes what food is available and individual choices that are made. Ultimately, the appropriate intake of essential nutrients determines overall health and well-being. For example, physical strength and endurance are all dependent on body weight, storage of body fat, and nourishment of skeletal muscle. Measure good health skills. Give performance a number. Compare that to a range from poor to ideal, 1 to 10. Record what is measured and use the numbers to evaluate improvement during training. Features of physical fitness have been defined by the military. Young men recruited into the military must be able to run 2 miles in less than 16 minutes, and young women in less than 19 minutes. Push-ups, sit-ups, and squats per minute are measured to define strength. Next comes training. Few can meet military standards. No one inexperienced in running would just go out and try to run 2 miles in 16 or 19 minutes. The result would be painful disability of muscles and joints. We know to start slowly and work up our skill and muscular capacity for effort. To measure and improve nutritional fitness is more difficult. Nutritional fitness depends upon supply and quality of nutrients and water. Macronutrients include carbohydrates, protein, and fat. Micronutrients include vitamins, minerals, and organic supplements. It also depends upon quality of food, specific nutrient requirements, and healthy food choices. Historically, nutritional fitness has been most concerned with underfeeding and deficits of macro and micronutrients. Now, we are more concerned with overfeeding and toxic effects of excess energy. It's out of place, stored in muscle, liver, heart, and other organs. Also concerned with effects of too much sugar and high levels of insulin on the brain. Principal cause of dementia in patients with type 2 diabetes. The average requirement for energy in men is about 1,800 kilocalories per day, with additional requirements up to about 500 kilocalories for strenuous physical work. Average in women is about 1,200 kilocalories per day, plus about 300 kilocalories per day for physical work. Note that the average energy intake of men in the U.S. is more than 3,500 kilocalories per day. Average for women in the U.S. is more than 3,000 kilocalories per day. Part of nutritional fitness in the military is measurement of height and weight. The ratio of weight and height is converted to a body mass index, BMI. Young men must have a BMI of 25.7 or less, and men over 40 years of age must have a BMI of 27.5 or less. Men with more muscle than fat may have high BMI. Their percent body fat is calculated from measurements around waist and neck. For muscular women, measurements are made around hips, waist, and neck. All young men are told to limit body fat to 18%, and young women to 26%. Those in the military who gradually fail to continue meeting standards are confronted. They're held back from promotion, transferred to lesser positions, or retired, unless their technical skills are essential to military operations and can't be replaced. Even the military becomes frustrated by failure of many to achieve and maintain good health. Only about 1/3 of all who apply to join the military actually meet the standards. 2/3 fail. Does that mean they're doomed? Well, not immediately, but most of us would have better health if we worked at it. What is the nutritional skill we're training? What are we trying to improve? And how do we start? And slowly. Even the military has trouble measuring skills for nutritional fitness. In modern times, sugar metabolism dominates every function for 24 hours a day. After every meal, insulin is secreted in response to levels of sugar and fat in blood, then clears them into muscle, liver, and fat. Skeletal muscle and liver use sugar and fat right away, and also store some for quick release. But after insulin stores energy in fat, it actually blocks its release. As long as sugar and fat are stimulating release of insulin, cellular metabolism loses the ability to release energy from fat. We come to rely on sugar metabolism for almost everything. Become incapable of using fat for energy. As a result, we get hungry when sugar in our blood falls to normal resting levels. Using fat metabolism is a special skill. The ultimate objective is to transition smoothly from sugar metabolism to fat metabolism between meals and overnight, without being uncomfortable because of hunger for sugar. There's lots of energy stored in fat, readily available, just as soon as insulin levels fall low enough to release it. The skill required is releasing fat from fat stores without irresistible pangs of hunger for sugar. In switching to fat metabolism, the basic strategy is to use more energy than is in the food that's eaten, to consistently increase physical work and lower food intake. After about 10 days, levels of sugar and insulin fall low enough to allow release of fat from fat stores. A good objective balancing intake and output of energy is to reduce food intake about 300 kilocalories per day and increase physical work about 200 kilocalories per day. There are several smartphone applications which are good sources of information about quantity and distribution of calories, carbohydrates, protein, and fat. These include MyFitnessPal, Spark People, Lose It. Measuring food intake is important. Just realizing there's too much being eaten and making an effort to eat less simply doesn't work. Training for fat metabolism is like training for running 20 or 30 minutes without stopping. Every day, you restrict calories as much as you can without serious discomfort, taking pride in feeling hungry while your metabolism is getting more efficient, using energy from fat. Eventually, energy you get from fat makes you feel good all day, not just for a few minutes after a meal, which is what happens when sugar is supplying all the energy. Get started by reducing calories by 50%. Cut everything you eat by half, except low-calorie, high-fiber vegetables. Start reducing 1 or 2 meals a day on 1 or 2 days a week. And keep eating less and less, especially sugar and starch, whatever you can manage consistently for the next 6 or 8 weeks. If you are currently injecting insulin at night, in the morning, or before meals, reduce your total daily dose by 10 or 20%. Whenever you measure blood sugar levels below 120 milligrams per deciliter. Then resume limiting food intake to further reduce levels of blood sugar. Keep measuring your basal heart rate before you get out of bed every day. As levels of sugar and insulin in your blood go down overnight, your basal heart rate will decrease. When levels of basal heart rate get down to less than 65, you can be confident you're using fat for energy while you sleep. If you would like to participate in our Type 2 Diabetes Recovery Program, you should sign up. Click on the link in the video description. After you sign up, you'll be asked to register and supply a few points of data concerning date of birth, smoking history, height, weight, blood sugar, and daily injections of insulin. We will call you and establish secure communication links for reporting and reviewing results, starting with fasting blood sugar, basal heart rate, and body weight. Then I will call you to ask about your medical history with type 2 diabetes. Also, we will discuss details of your goals and objectives for recovery from diabetes. In addition, we will set up an action plan for recovery. There is no charge for this service as long as you continue to report on a regular schedule and continue to work towards recovery from diabetes. We are dedicated to helping people recover from type 2 diabetes and maintain good health using telehealth technology.